Joining us now is Dr. Ashish Jha, Dean of Brown University School of Public Health. I want to pick up Dr. Jha. Good to see you, by the way.
Good morning. Thanks for having me on, Gayle.
Yeah, we love having you here. I wanted to pick up on Mola's point about the kids getting it. Pfizer's approving it for kids 12 and over. Do they get the same dose as the adults? And do you have any concern about children getting it?
So I don't have any concerns. The dosing we'll get the details on the dosing from the FDA. We've seen in the clinical trials that kids have tolerated this very, very well, and it's been highly effective. So I have two kids in that age range, and they're both very excited to get it, and I'm happy for them to get it because I really do think these vaccines are both remarkably effective and quite safe.
Okay, I was wondering if your own children were going to get it. What about the timeline for herd immunity? What are your thoughts about herd immunity? You know, we started out with you need to get 70%, 80%, 90%, and now we're nowhere close to that.
Right. You know, so there's a lot that's made out of herd immunity. I mean, look, we think it's about 80% of people need to have immunity before we get there. We're actually pretty far along. I think if we can get another 10 or 15% of Americans to get vaccinated, I think it'll actually make an enormous difference. Whether we hit that magic number or not, infection numbers will come way, way down, and that's what we care about. And life will go back to, you know, kind of a new version of normal. So I think we should worry less about that and continue focusing on getting more people vaccinated. That's how we're going to get back to normal.
Yeah, I even wonder if herd immunity is even possible. I wonder about that.
Yeah, you know, it'll vary from place to place. I mean, there will be communities, there will be states where immunity levels will be so high that they may hit herd immunity there. There'll be other states where it will be lower. But overall, as a country, we may have a bit of a hard time getting it. But what I care most about is, can we get the infections low? Can we make it safe to get back to our lives? And I think we can.
We keep talking about normal. I went out to brunch over the weekend with my niece and nephew. First time I've left my kitchen table in over a year and a half. I was watching about 80 to 90% of the people were still wearing their masks, myself included. And I took it off, and it felt weird to take it off. Is it really okay? I know you guys say it is, but many people still don't think it's okay to take your mask off outside. And you say, yeah, you can, vaccine or not. True?
Yeah, outside, I think vaccine or not, it is okay if you're not going to be around crowds. And if you're vaccinated, it's exceedingly safe to be off, to have your mask off outside. So I would not worry about it if you were vaccinated.
I know, all of a sudden I felt very naked. New York is talking about opening up in the next couple of weeks. Is this a good move for us?
Yeah, I do. I think New York's move is a good move. Again, New York has done a great job of getting people vaccinated. Infection numbers are plummeting there. Over the next few weeks, I think infection numbers are going to continue coming down. The key here is we got to keep vaccinating. We can't let our foot off the accelerator there. And that's really going to get us to a place where we can do all of these things quite safely.
All right, Dr. Ashish Jha, always good to see you.